Good evening, Minister, and to your staff. I know that it's a very difficult and challenging file, and certainly appreciate all the work that your office does. I just want to talk. There's constituents that are facing difficulties to continuing to access AISH and other programs in your ministry, and when they come from other provinces, and this can be a burden on healthcare. Can be a burden on the people that certainly need these things. Does your government have a plan to streamline the process for somebody who's seeking disability services from province to province? Where there's physicians and other healthcare practitioners alike, where these people have been approved. Again, many people come to Alberta to start a family and a life. They see opportunity here. So how do we make that? How do we make that, streamline that a little bit better out of your office?
I think these disability programs vary from province to province, and we have heard about concerns with respect to AISH program, and that is why we brought that AISH action plan. And that action plan will do essentially 3 things. There are 16 things, but they can be categorized in 3 major themes. One is with respect to access. We are finalizing a new application form, and instead of having a 3-prong application, there will be 1 application. And with that application, we are also preparing how to fill that application, those guide that will give clear guidance to individual and physician how to fill out those forms. Second thing we are looking at is that we are also trying to have better measures to measure the different processing time from the submission of application to the commencement of the benefits. So there are a number of things that are included in that AISH action plan that will make sure that this program is accessible and this program is transparent and Albertan can see how this program is working.
Right. So again, when we repatriate patients that the medical nature, trauma, or something like that, there's a clear line of sight between physicians from one province or jurisdiction to get them back to Alberta. The care seems to be seamless. We're dealing with people with disabilities, people with mental and physical trauma. How are you working with other provinces to come up with a standard for those disability supports right across the board, so that people aren't suffering every time they have to move for work or whatever it might be with their caregivers and that sort of thing?
At this point, I think all provinces have different programs. They differ from province to province, and the Alberta the AISH program we have is the most generous in the country, and it has its own legislation that was there from the previous government. We haven't made any legislative changes to that program, but what we are doing, that we are simplifying the application so that the Albertans don't have to fill in same information on different forms. We are making it more accessible, we are making it transparent, but as such, there is no cross-jurisdictional work across Canada going to harmonize all program. There is no such work in progress at this time.
All right, and I hate to belabor the point, but when it comes to the new form and streamlining it, do you have a timeline?
I think new form, we are testing it in Edmonton region.
Okay.
And it will fairly soon be available throughout the province.
Okay. Yeah. Okay. On page 31, it talks about that there's an increase in AISH caseloads. What is your ministry doing to address those? The increase to AISH caseloads.
What we are doing? Can you?
Yeah. Sorry. What are you doing? So, what's your government doing to address the increase in AISH caseloads?
We have provided stable and predictable funding to address the increasing caseload. It's a statutorily mandated benefit, and when Albertans fulfill those requirements set out in legislation, it's the obligation of the government to provide those supports, and so far we have increased funding to this program to make sure that Albertans who qualify do get these benefits.
Right. It would be fair to say that people that are applying for AISH, it takes a lot of courage for them to step up to the plate and ask for help for a lot of people, and to make sure that they have dignity, and with dignity and wanting them to plan their life and plan their finances around that, to have stability in AISH and the payments related to AISH. Would it be fair to say that we shouldn't be using AISH payments or increasing AISH as political football or political stumps, in terms of using it for our political benefit? So has your government studied how much it would cost per year to have AISH funding tied to inflation and remove that political football altogether?
I think AISH benefits do provide important support for almost more than 58,000 Albertans, and since we became government, as you know, there were tough times, but despite that we chose to support Albertans who are relying on AISH with predictable funding, and we are always open to listening to Albertans how to improve these programs, and hence that AISH action plan. But at the same time, we are taking a number of other steps that also help us prevent and reduce vulnerability within our province. For instance, improve funding for family and community sports services, low-income transit passes in Calgary and Edmonton. We are piloting it. Alberta Child Benefit, school nutrition program, wage increase, and those carbon levy rebates. So those are all things there to make sure that Albertans have the supports they need.
Right. So when we talk about those supports, would it also be fair to say that we've heard about the carbon tax, we've heard about minimum wage, and we've heard this over and over again, that these people that are helping vulnerable Albertans throughout the province, we've heard from them directly. Would it be fair to say, would you agree that some of those things were unintended burdens from some of your policies? And again, how are you going to address that? And I think it's to the bigger piece, and it's not intended to goat you or get into it back and forth again, because I think it's an important file, and I think they're just questions that people are asking. So what is the government doing to track the overall success of the programs in your department, whether they work, whether they don't work, with and again, going back to your trialing the forum here in Edmonton, how are you measuring this outside of the advocate not being there yet to give feedback? Where in your department do you look at this, have an overview of what works and what doesn't work?
I think we work with our community partners on all issues that matter to them, and business plan includes some measures of satisfaction with those supports. And I think there was question started with some other premise around minimum wage, I believe.
Yeah, right. Yeah.
So that was a campaign platform promise, and personally I have worked on minimum wage, and there are 300,000 plus Albertans who are in that minimum wage category, and as government we believe that everybody need to get paid fairly so they can put food on the table and have a roof on their head. In terms of delivery, we have worked with our community agencies, partners, to assess the impact of that cost pressure, and we provided them the resources they need to deliver services.
Right. So minimum wage, I don't disagree. People need a living wage. But when we talk about the carbon tax and talk about these communities and the people delivering the programs, I guess the question is, if you found that programs being provided, whether it's PDD, age low income, women fleeing violence, those sort of things, if you found an agency started to have to turn away people because of the carbon tax, would you revisit the carbon tax for these groups, and would you change course, or would you just stay the course for whatever reason, I guess that's the question. Would you change course if you found that people had to start turning away the most vulnerable people in our province?
I think if you have question more specifically related to climate leadership plan, you can direct them to Minister of Environment and Parks. With respect to its impact on the population we serve, for instance, there are individuals, 60,000, almost 60,000 Albertan on AISH, almost 50,000 Albertans on income support, those case lower. And as you may know, that 2/3 of the Albertans below a certain cutoff of income do get rebates. So actually those rebates have positive impact on those who are getting services from this ministry. And with respect to organizations, there are supports available, energy audits available, energy efficiency programs available that they can access to address those costs. But in short, my department is absolutely committed to working with our community partners to understand their cost pressures and provide them with the resources they need to deliver efficient services.
Right. Thank you for that, Minister. I guess in the absence of an advocate, you are the advocate right now for these folks that fall under your department. Have you had a conversation with the Minister of Environment that this is causing a burden? Have you advocated for these folks that are most vulnerable, saying, hey, perhaps we need to revisit the climate leadership plan when it comes to the nonprofit sector that delivers services? And if you haven't, why wouldn't you do that if you see that this is maybe an unnecessary burden? Now, I'm not saying this is not a conviction of anything. It's just a matter of when we see that something isn't working, is your minister willing to advocate and say, hey, maybe we need to change course to make sure that we are not turning away these people?
I think we believe in science of climate change, and as government, we believe it's the responsibility of the government to take action on the environment, and it's tied to many other things as well, including having the approval of Trans Mountain Pipeline, 2 pipelines, to get Alberta resources to the market. But when it comes to assessing how nonprofit delivers services, we will work with them, and we have worked with them on all issues. That's why there are programs like nonprofit energy efficiency transition. There are business nonprofit and institutional energy saving programs. So there are a suite of programs through that carbon pricing, carbon levy, that are available to the organization, and we will work with them to make sure that they are aware of these opportunities and they have access to these funds to address these pressures.
Has your department looked at the overall costs? Has there been a costing of what would happen if these folks providing these programs and services were exempt from the carbon tax? What would that mean for the overall budget? Would it be attainable? And just for the record, sir, I believe climate change is a serious issue that we're facing, and we need to deal with it. But I don't think that's the question put before us, whether I believe it or not, or whether the Alberta Party believes it. I mean, we need action on climate change. But the question is, if we have to turn away people, will your office advocate for these folks and say, look, maybe we need to revisit this? That's the question. Would you be willing to revisit it with these nonprofit groups as a part of your business plan to make sure that these people get the services that they deserve?
As I indicated in earlier answer, that the Albertans we serve, they are more likely than not, in all cases, are below that income cutoff where they are eligible for the rebates. So in fact, this
but not
climate
the
leadership has
group delivering the
positive
services.
impact on these Albertans. With respect to nonprofits, there are programs that they can avail, such as NEAT program, nonprofit energy efficiency transition. There are energy saving program, and there are rebates available. There are grants available to them through energy efficiency where they can address some of these cost pressures.
Thank you. A key strategy 1.2 on page 30 of the business plan speaks to the prevention of family violence and sexual violence and bullying. What specific measures in your budget are targeted at these prevention measures?
3.1.
What specific measures in your budget are targeted at these preventions for this prevention measure?
We have taken a number of steps to address family violence and sexual violence. With respect to family violence, we increased this funding by $15 million, and 2018 budget maintains that funding to address that family violence. And that budget will help us hire more caseworker, outreach worker, trauma workers to make sure that those who are fleeing violence have the resources and services they need. Second thing, with respect to sexual violence, on March 7th, we worked with Alberta Association of Sexual Assault Center, and they have presented us with a business case of $8.1 million through Justice, CSS, and Health. So we have provided $8.1 million so that they can provide the services that they need. Similarly, bullying, we are providing services and maintaining those funds in this budget 2018. And we are working with our partners across community through family and community support program grants. Over 3 years, we have provided almost $29 million to that end as well. So for government, it's a priority to make sure that all Albertans live in safe communities and no one suffers through violence.
No, and I have no doubt that you and your department are working hard to solve these things and work with these groups. So how do you measure the performance of these programs, this one in particular? Like who's measuring this and making sure that the outcomes are based in science, that we're helping people and that we're kind of evolving the program? And have you seen an increase in sexual violence issues in Alberta or a decrease? Like, again, how are we measuring that? What are the outcomes?
I think in terms of performance measure, I will direct you to 1B. And there are new performance indicators here. We are also looking at 1B, incidents of family violence. What we heard from Alberta Association of Sexual Assault Services, that they have seen an increased demand for their services. And there are a number of factors for that increase. And one was that when we became government, we funded I Believe You campaign. That was a very successful campaign, and we funded that for last 3 years. There was increased awareness through their activities, and there was other social media campaigns that were adding to that awareness. So they saw a huge increase, and we work with them to make sure that those individuals are getting the supports they need.
So based on 1B, it looks like so that the data comes from Statistics Canada, and it talks about instances. I guess, again, I want to drive down to the idea that the programs that you're providing and or the program providers, what are the outcomes of people that battle through courageously against sexual violence, family violence, bullying, and that sort of thing, to make sure that they are healthy people after the fact? Because we know things like this, I mean, there's a huge mental health impact that may go on for years again, so to make sure that there's less recidivism and that sort of thing.
Mm-hmm. So that's the data which is more about the reported cases, but there are 11 sexual assault centers, and we do work with them, and we do get reporting from them. They do publish their results as well. And usually when we provide them the grants, they do also require certain reporting measures tied to those grants.
Okay.
So that's how we see how many individuals are helped and how many people stayed on that counseling for how long.
Sorry, this might have been asked earlier, Minister, but how many PDD applicants are waiting for a decision right now?
There are 210 around.
All right, okay.
208, and they are waiting for the services.
Okay.
And we have added significant amount of money to this program, but wait list has been function of this program for a long time.
Right.
And there are a number of factors aside from funding that go into it. It's availability of services.
Thank
service
you,
provider
Minister.
of choice,
I
and
hesitate to
language.
interrupt, but the time allotted for this portion of the meeting has expired.